Celecoxib clinical uses. 1. Osteoarthritis. Celecoxib is used to relieve pain and inflammation associated with osteoarthritis, a degenerative joint disease that commonly affects the knees, hips, hands, and spine. 2. Rheumatoid arthritis. This medication is also used to treat the symptoms of rheumatoid arthritis, an autoimmune disease that causes joint pain, swelling, and stiffness. 3. Ankylosing spondylitis. Celecoxib is prescribed for the treatment of ankylosing spondylitis, a chronic inflammatory disorder that primarily affects the spine and sacroiliac joints. 4. Acute pain. Celecoxib can be used to manage acute pain, such as that caused by dental procedures, surgery, or injuries. 5. Menstrual cramps. Women may use celecoxib to relieve the pain and discomfort associated with menstrual cramps. 6. Familial adenomatous polyposis. FAP. Celecoxib is sometimes prescribed to reduce the number and size of colon and rectal polyps in patients with FAP, a rare genetic condition that leads to the development of numerous polyps in the colon and rectum. The usual recommended dose of celecoxib for adults is 200 mg taken once daily or 100 mg taken twice daily. The maximum recommended daily dose is 400 mg. It is important to take celecoxib with food or milk to help reduce stomach upset. The dose may be adjusted based on the individual's response to treatment and any side effects experienced. Important to note: celecoxib should not be used in patients with a known allergy to sulfonamides or other NSAIDs, as well as in patients with a history of heart attack, stroke, or gastrointestinal bleeding. It is also not recommended for use in patients with advanced kidney disease or those who are pregnant or breastfeeding. These are the most common clinical uses information of celecoxib, but it may also be prescribed for other conditions at the discretion of a healthcare provider. It is important to always follow the recommended dosage and instructions provided by your doctor when using celecoxib.